The Food and Drug Administration recommending the over-the-counter sale of birth control pills. A panel of federal health advisors voting unanimously in favor of drug maker Perrigo's request to sell the once-a-day pill without a prescription. Now, if the FDA does follow through, Perrigo's drug, called O-Pill, would be the first contraceptive pill to go from behind the counter to store shelves. And joining us to talk about that and some other health stories topping the news today, Dr. Bill Hartman, principal investigator for UW Health Pediatric Moderna COVID-19 vaccine trial. Thank you so much for being here. We've got a lot to get to today, so let's just jump in with this news from Perrigo that this may be available over the counter. This is really a game changer in the landscape of birth control.
Right. So this is O-Pill, which has actually been approved by the FDA for prescription use since 1973. So it's got a long safety profile, a long efficacy profile. People know how it works. There are some concerns from the FDA going forward, though, with this. The first is, does this pill work effectively in women who are overweight or obese? There's some studies that indicate that perhaps it's not. Overwhelmingly, most studies show that it is safe, but there is some concern there. The other is that from the pills makers that ran a study to see if women were taking this over-the-counter, the future over-the-counter pill correctly, and the studies actually indicated that some women were not taking it correctly. And obviously, there's a time essence to taking birth control. You have to take it the same time every day or within a few hours of the same time every day for it to be effective. If you don't do so, it won't work for you.
Well, and Dr. Hartman, here, I'm reading some notes here that the FDA also expressed concern that without counseling from a doctor, women may think this is okay, but they may not realize this is not really the best thing for them. So you really do have to consult with your doctor and get a thorough analysis if this will work for you, correct?
That's absolutely correct. Some women with a history of breast cancer, some women with a history of vaginal bleeding of unknown origin shouldn't be taking this pill. So it's not a pill for everybody. It is a step in the right direction for birth control, however.
From pills to peanut allergies, this is a big deal for especially kids who suffer from peanut allergies. Talk about this new patch that may be available to help them get through this.
Sure. So this is a late-phase clinical trial out of Colorado, looking at 322 kids who had a diagnosis of a peanut allergy. These kids are between 1 and 3 years old, where there is no current treatment. When they put this patch on the children and followed them for a year, what they found was that the peanut allergy in many of these kids had diminished. It wasn't down to zero, but it was greatly reduced compared to the original allergic reaction that these kids had.
And lastly, let's talk about pancreatic cancer. For those people who have lost people to pancreatic cancer, for those suffering from this, there has been little hope on the horizon for any type of vaccine. However, this new vaccine, now that it's talked about, actually boosts T cells that target the tumors. This is breaking. This is, it seems like something that is giving some encouragement to people who are suffering from this debilitating disease that oftentimes gets diagnosed very late in the late stages.
Right. So pancreatic cancer, like you said, does get diagnosed very late in most people and is quite lethal. There's been very little improvement over the past 50 years or so as well. Now, researchers have found that people who have a better prognosis following surgery they have these cells that can attack cancer cells. They survey the body and can attack cancer cells to prevent recurrence. In the people that don't have these cells, they're able to be induced with a vaccine that has some of these cancer epitopes in them to cause that response, that survey and kill response by these T cells. And so it's the first real hope that you could take a person who had a poor prognosis and give them a much better prognosis following surgery.
Yeah, that is wonderful because it's such a punishing disease. So we could go on and on, but we'll save more questions for next time. Dr. Bill Hartman, thank you for being here and answering so many important questions on this beautiful afternoon. Thanks.
Thank you.